Good morning, everyone. Today is February 3rd, 2010. I am starting day 10 of the clean program. Things are going awesome. Very excited with all the good results that I've been having over this first 10 days of the clean program. So just about at that halfway point. Now, I want to start today's video update with a question, and I'm going to ask you a question. Are you being affected by the dirty dozen? And you might be asking what the dirty dozen is. If you are a patient of mine, you've heard what the dirty dozen is. But also, I'm going to be starting to do a webinar series on the 12 modifiable factors of chronic disease, and we're going to call it the dirty dozen. Now, when patients come in, they come in with a multitude of symptoms. Some named diagnoses, some unnamed diagnoses. But when you go to a conventional medicine practitioner, you go to mainstream medicine, if you don't get put into a box and you don't get an ICD-9 code label placed on you, then the doctor doesn't get paid and insurance doesn't pay out, and so you fall into a category of trying to be placed into a box. Well, guess what? Nobody fits into a box. We're all unique individuals. And the reason you might have high cholesterol is not the same reason that your spouse or your neighbor or your friend down the street has high cholesterol. And so what we look for is we look at the 12 modifiable factors of the chronic disease processes. And those 12 factors are this. Number 1 is stress. Number 2 is toxins, digestion, sugar, food reactions, inflammation problems, methylation problems, immune system problems, infection, hormones, mitochondrial dysfunction, or heavy metals. And so those 12 factors, if you can look at that as a underlying systems problem, and you can begin to regulate and normalize those 12 issues, then guess what? You can regain your health. And when you'll find that the majority of those, especially the number 1 and number 2 on that list, stress and toxins, those are modifiable factors. Those are something that you can do and you can change based on your diet, your exercise, your lifestyle to make you healthier. I have patients coming in every day and they're tired and they're sick and tired of being tired, to borrow the old cliche. But they are tired, they're not sleeping well, they're on 5 to 6 medications, they're overweight, they're pre-diabetic, they have decreased libido, they aren't happy with themselves, they have depression and anxiety. Their world's just falling apart, and really when you look at the cause of it, you can actually put everybody into a box, so to speak, of looking at the 12 modifiable factors and say, can we change these, and if so, what kind of improvement can we get? Borrowing the cholesterol example, your cholesterol might be elevated because you actually require more cortisol. If your adrenals are stressed and you are fatigued out and your body needs more cortisol, it's going to upregulate your cortisol production, your cholesterol production rather, to try to shunt more of that cholesterol down to your cortisol. If, for example, you're very inflamed, an antioxidant is cholesterol. And so when you go in, your doctor says, well, you have high cholesterol, let's put you on a cholesterol-lowering medication. We know that that's not the best thing. We know that the side effects of statin drugs can be muscle pain and rhabdomyolysis and joint pain and decreased libido and cognitive decline and all these negative things that we don't want to have. But the reason is, what's causing that rise in cholesterol? If there's one thing I can leave you with today, and I want you to understand this, I think it's so important. And when I was first presented with this paradigm, this way of thinking, it really changed my life and my practice. Number 1 thing is this: survival. Your body always does what it can to survive. And so when it's pushed into a situation, it's always going to try to push back into a survival mode. When your cholesterol rises, it's doing that to try to survive. When your inflammatory markers rise, it's doing that to try to survive. When your autoimmune markers rise, your body's trying to survive. And so rather than trying to suppress markers, let's begin to look at the body and say, what modifiable factors do we have going on that we can change that will show the underlying root cause of these problems? And so again, stress, toxins, digestion, sugar, food reactions, inflammation, methylation, immune, infection, hormones, mitochondrial dysfunction, heavy metals. Are you being affected by the dirty dozen? And if so, I encourage you, find a functional medicine practitioner, find someone that you can talk to, that you can schedule an appointment with, get in and talk to them. It's amazing what you can even do now over the phone and over the internet. We can actually take a very thorough history. We can do saliva testing, blood testing. You can actually set up a relationship with a functional medicine practitioner via long distance. And so it's very, very easy to do that nowadays. But find someone that's going to look at your underlying causes and try to find what's going on with you and try to make some changes. And one of those changes that are going to definitely be a part of your life, or should be a part of your life, is a good detox. And we offer a variety of detox programs in our office this year. For my annual detox, I've chose the Clean program, and I'm very, very happy and satisfied with the results I'm having. And so we're looking forward to hearing what the Clean program is doing for you and how you're going with things. If you have any questions, please feel free to drop me an email directly at drsefcek@leclinic.com. Also, if you want to be kept up to date on any upcoming webinars that we do, including the Dirty Dozen webinars we have scheduled, go ahead and go to our website, www.leclinic.com. Keep a tab on the upcoming events there. Also, sign up for our free newsletter. And in that newsletter, we only send out a couple a month. We're not going to use spam or anything like that, but we send out a couple emails, and I'll actually email out a newsletter to let you know about the upcoming dates for the webinars if you're interested. So again, thanks for tuning in. I hope things are going well for you. Have a great day. You guys take care.